most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to go over our series here. What is causing your knee pain, or part of our series? Osgood Schlatter disease? How to tell? That must be a German name, right?
I would think so, Bob.
So we're going to get right into it. Osgood Schlatter disease is a common but temporary knee pain that it can affect older children and teenagers as a specific age, actually. And it usually involves kids who are involved in sports like that involve a lot of jumping or knee bending.
Sure.
Like, hockey, you're skating, your knees are bent.
Yeah.
Basketball, volleyball, skating, soccer, ballet, gymnastics.
Pretty much all of them.
Yeah. It's really a bummer of a disease.
Yeah.
Because
it doesn't go away quickly. It usually lasts for months or.
Right. And the thing is, the good thing about it, it goes away on its own eventually. But the bad thing about it, it usually occurs right, if you're a boy or a girl, you're participating in sports in high school, you might be in the peak of your abilities, and it can put a shut down your sports.
Yeah, it's painful and.
Yeah. So what happens in this case is, Brad, do we maybe want to? So we're talking about pain that's occurring. I'm going to show it on this, and then Brad's going to show it on here.
Yeah, maybe we'll have a knee
So
on there too.
we got the full leg here, and we got the kneecap is underneath the patellar tendon.
Yep.
And the tendon underneath the kneecap or below the kneecap attaches to this bone right here.
Yep.
And that's where the inflammation occurs. Brad's going to show it on this model.
Yeah, so we have just the knee, the quadriceps, the kneecap, the tendon, and then in black, if you were to lift this up, that's where the black there tendon connects to the bone right there, and that is where the problem lies with the Osgood Schlatters.
Yeah, it's pretty simple why this occurs. So it's generally when somebody is going through a growth spurt. And it can occur in boys usually from age 11 to 18, and that's when my growth spurt actually. I had it when I was 19.
As I remember, I knew you were going to say that. It's like,
and girls, it's usually a little earlier. They mature earlier, and they stay more mature. So they're age 10 to 16. But so the bones are growing really fast, but the tendon is not keeping up.
Mm-hmm.
So this tendon is being too short. It's pulling on this bone aggressively, and it causes inflammation. It can even cause it to overgrow. Like you can get
calcium buildup.
You get a big bump there.
Yeah.
And
I think that becomes painful also when you kneel on a hard
floor.
Oh,
yeah, of course.
Yeah,
of course. We'll talk about some things you can try to do to treat it in the next video. But the pain usually occurs in one knee, but in 20 to 30% of the cases, it occurs in both knees.
Bilateral. Wow.
Yeah. Again, it's more common in boys. It can continue for 6 to 18 months, which is, until the growth spurt has stopped.
Right.
Basically, and the tendon can catch up.
I know these are results from the study, but I've seen comments from our last video, which has been out for quite a while. It sounds like some of them had it for some years.
Yeah,
I don't know.
I think that some of the results of it being occurring doesn't go away sometimes if the bump has gotten too big and there's some, like, once in a while you have to have surgery on it. You have to actually have that bump shaved down.
But the majority is
goes away. Yeah.
Yep.
I was really worried with my son. He had a good athletic career in high school, and I was always afraid he was going to
have it.
Yeah, because he was growing pretty fast, but luckily he never did get it.
Yeah, good.
So how do you tell if you have it? It's pretty simple. You're going to have pain, Brad. Well, I can show you. You're going to have pain, tenderness, redness right on the tendon or the bony bump right here.
Yeah.
So you just got to feel it there, and it's gonna go ahead, Brad. You're just going to say something.
Yeah, on a real knee, just like this, I've got a black spot where it is. Where the kneecap is here. And you can feel that tendon. If you flex your quads, you can feel that and maybe even see it there. Right there's that tendon. And You'll know because he'll
Yeah,
push
it'll
around
hurt
there,
right there.
and it makes your eyes open up and say, "Ouch."
It's really not hard to diagnose, to be honest. And generally, it's going to get a lot worse with jumping or knee bending. And the doctor may order X-rays, but in most cases, I don't think they have to.
Yeah.
So we're gonna, we can't make this pain go away, but we can help you manage it.
Sure.
So we'll show you that in the next video, how to treat Osgood Schlatter disease. That must be a good German name, right?
I would think you said that already, Bob.
Did I?
Yeah, that's
Well,
all right.
I confirm it. So it must be two Germans, right?
Probably.
Yeah. So
We'll look up some
we'll look it
history.
up. So, all right. Thanks for watching.